Hello, my name's Colin Fields. I'm a physical therapist at Joint Ventures Physical Therapy at the Kendall Square location. And what I want to talk to you today about is something called the cervicothoracic or the CT junction. Now, what that CT junction is, it's looking at the spinal segments of C7 and T1, and it's located at the very bottom of the neck, so the base of the neck. It's a spinal segment that's a point of transition from the flexible and pretty mobile neck or the cervical spine, and what it does is transition to that less flexible and kind of immobile thoracic spine, that upper thoracic spine. It's a common area of interest that we're looking at with physical therapy just based on postural abnormalities with everything, when we're texting and eating and reading in that frontal plane, a lot of times that CT junction area can get a little bit irritated. It's also something where if you have limited neck movements, a lot of times that CT junction can be a factor in that. And then, it's anywhere from elbow pain to any radiculopathy. You always want to make sure that you're looking at that transition point and making sure that everything is moving as well as it needs to be. So today what we'll look at is how to mobilize and eventually manipulate that cervical thoracic junction with a pretty simple technique. And when we would use this technique is when we have neck pain with some biomechanical restrictions found. So when that patient comes in, you're seeing that limitation in movement. When the neck may be a little bit too acute to immobilize, so when somebody comes in and they have a pretty acute neck, sometimes when we're trying to do our PA mobilization or manipulate the neck itself, it might just be a little bit too irritating. So sometimes going after that CT junction is a good way to treat that neck indirectly. When there are other yellow flags that are present, that's a good time to start looking at that CT junction. And when you're actually palpating the neck and you find a hard end feel at that CT junction, or if the C7, T1, or T2 segment itself is restricted or limited in its movement, that might be a good time to look at this technique. Finally, if we're looking at just our cervical scan and we're looking at flexion and there's some limitations with that, or if there's limited rotation bilaterally in that last 20-degree range, this would be an appropriate technique to use. So what we'll do is we'll go over that in the next video and show you how to properly set that up and make sure that the patient is as comfortable as possible.